South Korean junior doctors' collective action against the government's plan to add 2,000 more medical school seats starting next year has entered its 15th day. As of Monday, the government has initiated steps to suspend the licenses of trainee doctors for 3 months. Well, starting Tuesday, the government intends to send documents to the defiant trainee doctors as part of the administrative process to suspend their licenses. Despite the government's ultimatum, though, the striking trainee doctors who have not returned to the hospital site are reportedly braced for the 3-month suspension of their licenses.
지금 사직해서 나와 있는 전공의들은
The medical professionals who have resigned are not afraid that their training will be delayed by another year. Even thousands of medical students are not worried about a year's delay in their studies. Therefore, I believe we can work together for now.
She, majoring in cardiothoracic surgery, says she has been dedicating herself to essential medical care even at the cost of her own well-being. If her license were to be suspended or revoked, she questions whether those 2,000 people would willingly major in essential medical fields like pediatrics or internal medicine in the future.
그러면 이번 정부에서 만약에 이 정책을
If the government proceeds with this policy and unforeseen consequences arise in 10 years, when we have an additional 2,000 people, who will be held responsible for this healthcare policy?
그때는 누가 책임지실 건가요?
An Duk-sun, professor emeritus of Korea University Medical School, asserts that increasing the quota by 2,000 is arbitrary.
어느 지역에
We lack specific data on the number of doctors needed in various fields of practice and regions within the country. Therefore, the question is not merely about how much we should increase quotas for universities in specific regions.
Some medical experts have criticized the government for emphasizing the lower than average number of doctors per 1,000 people among the OECD countries while overlooking other relevant data. According to Park, South Korea boasts the shortest waiting time for treatment, the highest number of hospital beds per population, and a rapidly growing doctor population.
따라서 의대 정원을 반대하는 이유가
Contrary to the misconception that opposition to medical school quotas is solely about doctors' income, the reality is more complex. Rising medical expenses lead to an increased demand for doctors, but this also accelerates the depletion of health insurance reserves, potentially impacting future generations significantly.
Despite the government's firm stance, confusion in the medical field is anticipated to intensify. Some medical school professors have resorted to shaving their heads or submitting resignations in protest. Meanwhile, trainee doctors continue to refrain from returning to work despite the government's warnings of disciplinary measures. Yoo Sumin, CGTN, Seoul.